We continue our series for the children, and joining us today to discuss preventing substance abuse is Drew Hayes from Dothan Pediatrics. Drew, welcome to the program.
Thank you for having me.
All right, now let's talk about this. When you say substance abuse, what ages are you talking about here?
Well, at our clinic, I mean, we deal with kids all the way from young kids to older teens, but as far as substance abuse issues, it can happen as low as, below 10, younger age, but predominantly in teenage years.
Okay, what are some of the substances you see that are abused?
Well, usually it's, most often it's like alcohol, marijuana, and oftentimes nowadays it's prescription pills also, because those are easily accessible from either parents, medicine cabinets, or other kids at school that have them, that sort of thing. And then sometimes it can be other things, harder type drugs. It just kind of depends on their age and how long they've been using and what kind of access they have.
Okay, now tell us, at what age does prevention begin, I guess, in life?
Well, I guess when it comes to your family, it would be from the very beginning, because probably the best prevention is having a close relationship with your child so you know what's going on. And also, the younger a child tries a substance, the more likely they are to become dependent as an adult. So the sooner you can prevent something from happening, the better off you're going to be.
Gotcha. Okay. Now, how do you, when they come to you and maybe have an issue with substance abuse, what are some steps that you guys take to help them?
Well, it really depends on what's going on and how long they've been using and what they've been using. There are different types of treatment, either just outpatient treatment like at the clinic. If something more severe, we may refer them to somewhere for inpatient, some family counseling, some individual. It just really kind of depends on the specific issue and what they've been using.
Okay, so really the best way, I guess, is just to be involved, though, right, and to stay on top of what they're doing all the time?
Yeah, communicating with them, knowing what they're doing, knowing who their friends are, really getting to know your child and not being distant from them, and not being, just having the idea that nothing can happen to them and they're not ever doing anything wrong. Teenagers in general often try to distance themselves from their parents, but it's important to try as much as you can to be open and provide the opportunity to discuss things with them. Okay,
now we've got about 30 seconds left. Tell me some signs that you should that we should look out for. I guess teenagers are already distant. How do you tell if this is a possibility for your child?
Well, like I said, the biggest thing, first of all, is watching them, being around them, knowing what they normally do. If you start to see changes in their mood, they start to act differently, if they start to become more irritated, less motivated, having failing grades, behavioral problems, that sort of thing, that's always something that should be assessed to see if that's a possibility of what's going on.
Okay, okay. Should you ask them?
Yeah, definitely you can ask, and just having that open communication is very important.
Excellent, excellent. Thank you for joining us today. That was a pretty informative session there.
Thank you.
And if you have any questions for us about our segments, you can email us at morning@WTVY.com. Also, if you'd like to catch this one again or catch other interviews, hit that web channel, WTVY.com. Good.